If you're dealing with poor circulation, cold feet, heavy legs, or even weak blood flow down there, you're in the right place. Poor circulation can drain your energy, slow healing, and make everyday life harder. But the good news is that relief may be just a few simple presses away. Today, I'll show you 3 pressure points, one on your hand, one on your leg, and one on your foot, that many seniors use to warm cold toes, boost blood flow, and restore steady energy naturally. I'll guide you through the exact spot, how hard to press, and how long to hold so you can follow along safely and feel the difference. Let's start with the hand point that many people notice working within 60 seconds. This thumb web point, known as Li4, acts like a fast access switch you can press at the kitchen table, on the couch, or while waiting for water to boil. It's simple, quick, and you don't need any gear. Many people miss the effect because they skim over the exact location, but once you land on the right notch and hold steady, the response can feel different, less fidgety, more settled. Coming up next, you'll feel how to lock onto it within seconds. Here's the setup. The Li4 point sits in the firm skin between your thumb and index finger. It's in that little valley where the webbing feels meaty. Instead of rubbing the whole hand, zero in on a single tender spot. Research notes that this area sits near the radial or first dorsal metacarpal artery, and it's close to where branches from the superficial branch of the radial nerve reach that artery. That layout matters because targeted acupressure at specific points can influence local blood flow, likely through mechanisms such as autonomic nervous system modulation and changes in vessel tone. So location and pressure aren't just details, they're the trick. Most people rub lightly and feel nothing. The difference is targeted location and steady, comfortable pressure. Let's find it now. Open your hand. With the other hand, place your thumb in the fleshy web between your thumb and index finger. Slide your thumb toward the bone ridge at the base of the index finger until you meet a small, tender notch. If you drift too close to the crease, you'll miss it. If you're too far back toward the thumb, you'll hit soft, dull tissue. The spot you want feels dense and a bit sore in a helpful way. Press straight down with firm, comfortable pressure for about 15 seconds, then release for 15 seconds. Repeat for several rounds. This on-off rhythm is common in reflexology practice, and studies have used various durations, with some effects appearing after sustained pressure applied over minutes. Breathe in through your nose, and as you press, let a slow breath out, like fogging a mirror. That breath helps your nervous system settle, which can support vessel relaxation. Switch hands and do the same rounds. Keep your shoulders loose and your jaw soft while you work. If you have neuropathy, arthritis, or hand pain, start gentler than you think. You're aiming for a deep, dull ache, not sharp pain or numbness. Stop if tingling or numbness persists after release. If you're pregnant, avoid this point unless your clinician clears it. Skin should be clear, no cuts or infections. Thumbs tired? Use a pen cap or a rounded spoon handle to deliver steady pressure without strain. Keep the tool rounded, not pointy. You can also brace your pressing hand on a table to control the depth. Many people feel warmer fingers or a small drop in tension within 60 to 90 seconds. With this control spot now awake, you're ready to move to the next area, where targeted pressure often wakes up the feet and supports gentle downstream warmth. The energy arch sits along the inner edge of your foot and can help restore steadier energy and comfortable warmth when you use it with intent. Your arch hides a power strip. Press the right 2 inches and your feet may feel like they just woke up. This inner edge of the foot is mapped in reflexology to areas that support brain clarity and kidney balance, and when you press with purpose, many people describe a cleaner, brighter lift than from casual rubbing. Keep watching because the way you make contact and hold steady makes a bigger difference than most expect. Sit tall with one ankle crossed over the opposite knee. Look at the inner arch, the side that faces your other leg. You're going to trace a tender line that runs from just below the ball of your foot down toward the heel. Think of it as a short track with 2 stations. The upper third, tucked just below the ball, is the brain-related zone in classic reflex maps. The middle of the arch is the kidney-related zone. These two stops work well together when you want warmth and steadier energy without a long routine. Quick rubbing often falls short. Research from Thailand used Doppler ultrasound and found that brain-associated foot reflexology increased blood flow to the brain, measured via carotid assessment, compared with light touch controls. In that work, pressure was applied at the reflex point until the practitioner felt maximum resistance, rather than using a preset force. The takeaway here is practical. Targeted location and sufficient, comfortable depth can matter, while light, unfocused touch tends to do less. Here's how to do it. Start at the upper third of the arch. Place your thumb on the tender spot and ease in until you feel a firm, helpful ache, not sharp pain. Hold steady, then slowly release. Repeat a few cycles, move to the mid-arch and use the same rhythm of firm, comfortable pressure followed by a brief ease-off. After both stops, glide your thumb slowly between them for 20 to 30 seconds, like connecting the two stations with one smooth pass. Keep your breathing slow and even while you press. Timing note: research sessions in reflexology often run much longer than what we're doing here. Think of this as a shortened, practical approach inspired by traditional techniques, brief holds with calm breathing you can fit into a daily routine. If you prefer, extend the holds to 30 to 60 seconds per cycle and add a few extra rounds. If your thumbs tire, place a tennis ball under the inner arch. Sit, let your weight settle until you feel that same deep ache. Hold, then release and repeat for several cycles at each stop. A warm towel or a 5-minute foot soak first can make the tissue more comfortable and may support gentle vasodilation, which pairs well with the pressure work. Safety first if you have diabetes or neuropathy. Inspect the skin before you start. Skip any area with a crack, callus split, or ulcer. Keep pressure moderate, and stop if tingling, numbness, or pain lingers after you let go. The goal is comfort plus warmth, not soreness. By the end of these cycles, many notice warmer toes and a subtle lift in alertness. Stay seated for a moment and feel that change, because your lower leg has one more key spot that can reinforce this effect. The calf reviver targets a proven lower leg point that can help restore warmth and ease in your feet and ankles. One point below your knee has been linked to better blood flow and calmer blood pressure responses in research, without needles. This lower leg spot is called ST36 or Zusanli. When you press it with intent, you tap into pathways that help vessels open and your system settle. For older adults, and especially if you manage diabetes or cold feet, this is a practical way to support daily circulation in a few minutes. Here's the setup. ST36 has evidence for influencing nitric oxide activity and the balance between your fight or flight and rest and digest systems. That matters because nitric oxide helps blood vessels relax, and a calmer nervous system can steer blood to where it's needed. In one clinical study of people with peripheral arterial occlusive disease, acupressure on a set of lower limb points that included ST36 increased oxygen levels measured on the legs and feet during the session. The method used a non-invasive test called transcutaneous oximetry, suggesting real-time changes in local perfusion. Here's the mistake to avoid. Many people rub the middle of the calf and stay in soft muscle. The target sits closer to the shin's outer edge. Precise placement is the key to getting the response you want, not more time or harder pressure. When you land in the right trench, you'll feel a deep, comfortable ache rather than a sharp jab. Find it now. Sit on a chair with knees at a right angle. Start at the bottom edge of your kneecap. Measure 4 finger widths straight down along the front of the leg. From there, slide 1 finger width to the outside of the shin bone. You should feel a small groove in the muscle beside the tibia. That groove is your zone. If you're on the bone, move outward a hair. If you're too far into soft calf, move back toward the bone until the trench returns. Press with your thumb or knuckle inward and slightly upward, as if aiming under the tibia's edge. Hold for 15 seconds. Release for 15 seconds. Repeat 5 cycles on the same leg. As you press, breathe out slowly through your mouth to encourage relaxation. Switch legs and repeat. Keep your ankle relaxed and let the foot hang so you're not fighting against tightness. Note that many research protocols use longer single-point holds, often several minutes, so consider this a practical, shorter adaptation you can apply daily and extend if you prefer. If reaching is hard, use a rounded tool like a spoon handle, or sit with a small ball between your leg and a wall. Lean until you feel a steady, comfortable ache, then hold the same 15-second rhythm. Avoid pointy tools. A few safety notes: do not press directly on the shin bone or over varicose veins. If you take blood thinners or bruise easily, go lighter. Stop if you feel sharp pain or cramping. Skin should be clear of irritation. After both legs, many feel lighter calves and warmer ankles, and even a short hallway walk can feel easier. Keep this point in your toolkit as part of a simple routine you can return to whenever you need a quick reset. Quick check-in. Do your feet feel warmer and your legs a little lighter? Great. Don't let that progress fade. These 3 presses switch things on, but keeping blood flow steady all day often needs nutrient support. To keep those vessels open, supporting warmth, healing, and even healthy intimacy, your body needs the right vitamins to fuel circulation from within. That's exactly what we'll cover next. The top 3 doctor-recommended vitamins that boost circulation and intimacy in diabetics. They work with the pressure points you just learned, supporting nitric oxide, nerve health, and vascular comfort, so today's gains don't fade by evening. Tap the video to lock in your results from the inside out.